Good afternoon, and thank you for joining the Health Department's weekly Friday briefing with Dr. Farley. Today, we'll be joined by Veronica Hill-Melbourne, President and CEO of Spectrum Health Services, Inc. Both she and Dr. Farley will be talking about COVID-19 vaccine distribution and ways that the city is making it available. Following their prepared remarks, we will provide those remarks in Spanish. Then we will open the floor to questions from the press. Today, we'll be ending at 11:30. Now let's get started. Dr. Farley, you have the floor.
Thanks, Matt. And I know we're here to talk about vaccination, but I do need to point out that our case counts from the coronavirus are rising, and we all need to be careful and not let down our guard too soon. When we talk about vaccination, the supply of doses we're getting from the federal government are now level. We have been seeing increases week to week, but now the federal government is telling us we will not be getting additional increases of the Pfizer or Moderna vaccine over the next 3 weeks. It's unclear when we'll be getting any more additional doses of the Johnson & Johnson vaccine. So with that increase level of doses we're getting each week, and increasing the number of providers and then increasing vaccinations that providers are giving, we're going to have to watch carefully to make sure that the supply of vaccine coming into the city meets our ability to deliver in the city. As far as our administering vaccine in the city, as of Thursday, we reported vaccination on 402,000 people with their first doses and 156,000 people with their second doses. Now, give you a sense of how many total doses are being administered by all the providers across the city, for the week ending March 7th, they delivered about 96,000 doses. That was up from 54,000 the week before. And the week ending March 14th, they delivered 104,000. And that's more yet to be counted. So it has nearly doubled in the past 2 weeks. Much of that increase is from the convention center, but there have also been increases, from other providers as well. One provider that's done an outstanding job is Spectrum Health Services, which is a federally qualified health center that's for reaching a predominantly African-American population with very high numbers. According to the data I'm looking at, they delivered 795 doses in a single week. And so you're going to talk in a minute you're going to hear in a minute from the CEO, Veronica Hill-Melbourne, who I really appreciate having done such great work on this. As far as eligible groups, we're still in phase 1B, and including frontline essential workers and people over the age of 65 and people with high-risk medical conditions. We are, effective today, adding some new groups to this phase 1B that came through a request and review of our, our vaccine advisory committee. Groups that will be added to the high-risk medical conditions are people with intellectual disability. That was based on a very large new study showing that these people are at high risk for COVID mortality. That study was authored by Dr. John Gleason of Jefferson. It was done here in Philadelphia, and the findings were very persuasive. In addition, we are adding an expansion to the definition of immunosuppression as a qualifying condition. In the past, it's been just immunosuppression from organ transplant or HIV, but now it includes people who are taking medications to suppress the immune system for any cause. And we'll also be adding to phase 1B members of the clergy. With religious services restarting, members of the clergy are at high risk for acquiring COVID infection and transmitting it, in particular transmitting it to people who are elderly. And so we view them in a sense as frontline essential workers, and so they will be included in phase 1B. How's the vaccine being made available today? Well, we're continuing to expand the number of providers. We have an additional 8 to 10 independent pharmacies that are enrolled this week. And then there are new community clinics that the health department is running. This past week, we were at Simon Gratz High School in Nicetown. We were at the Grand Yesha Ballroom in South Philly, and we were at the EOM Athletic Center at South Philly today. Next week, the fire department is going to be running clinics at Cannstatter Volksfest Verein and at Salvation Army at 5501 Market Street. Now, as you probably heard, in this past week, at some sites, our advance appointments had been low, that only some of the slots available were taken. And so we began taking walk-ins from people who met our eligibility criteria. That was done at the Martin Luther King Older Adult Center, and it was done at the Simon Gratz High School site, and it worked actually quite well. Now, there are no open slots for early next week at the Grand Yesha Ballroom in South Philadelphia. And so this is something we have to take on a clinic-by-clinic basis. If there are open slots, we will pull a word out the night before or the day of that we have open slots and people can walk in. As this is, I would say, a transition period, I hope in the future that all these clinics can be walk-in only. but we're not quite there yet. And I should also note that there are some clinics that are only for people to get their second dose. And at those sites, we cannot take walk-ins for people who are coming in and want their first dose. Now, the convention center clinic has continued to do about 6,000 people per day. Later today, they will hit the mark of having vaccinated 100,000 people, which is quite a milestone. Now, the volume is great, but we were having problems that the people vaccinated there were underrepresented among those who are African American and those who are Hispanic. Up until now, about 13% of the people vaccinated were African American and 11% were Hispanic. And related to that, we were having low vaccination rates in the low-income, predominantly African American and Hispanic neighborhoods. So starting late last week, we are using half of the slots for walk-ins for eligible people who live in the 22 lowest vaccinated zip codes. Early data says that this is working. As of yesterday, of those folks who were vaccinated, 22% were African American, 21% were Hispanic. So that's nearly double what we were seeing before, and about 20% were Asian. So we will continue to have that go on through Monday, and we'll continue to do outreach to those under-vaccinated neighborhoods to encourage people to come in. So what should people do who want to be vaccinated? Our vaccine interest database is the best mechanism that gives people an opportunity to be invited to a number of different sites for vaccination. That's www.phila.gov/vaccine-interest. Or if people don't have the internet, they can call 311 and they'll get in the database. Or if people live in these designated 22 low vaccinated zip codes, and they're eligible based upon their age of over 65 or having high-risk medical conditions, they can walk into the convention center any day from 8 to 5, today, Saturday, Sunday, and Monday. They should bring an evidence that they live in those zip codes, like an ID or a bill or any piece of mail. So thanks very much, and I want to turn over now to Veronica Hill-Milbourne.
Thank you, Dr. Farley. Veronica, if you can unmute yourself, you have the floor.
Okay, good afternoon, and thank you so much, Dr. Farley, for your kind introduction. I'd like to just share some information about Spectrum Health Services. We are a federally qualified health center. We operate 3 community health centers and been doing so for nearly 55 years. Our locations, our largest location is at 5201 Haverford Avenue in West Philadelphia. We also have a health center at 1415 North Broad Street in North Philadelphia and 1325 South 33rd Street in South Philadelphia. Spectrum has been viewed as a trusted community partner, as I mentioned, for nearly 55 years. And we offer an array of services, primary care, adult and pediatrics, dental. We have a partnership with the University of Penn School of Dental Medicine, behavioral health, dietary and nutrition support, HIV, AIDS, Hep C treatment and outreach. We have our own in-house pharmacy where we offer our 340B discount drug program. And we've been offering COVID testing since March of 2020 and now actively participating in the vaccination program in partnership with the Philadelphia Department of Public Health. For those who are interested in receiving the vaccine, the COVID-19 vaccine, and we're currently offering Moderna, we ask that people register online at our website at www.spectrumhs.org. We are not able to accommodate walk-ins, so all appointments must be scheduled. For those individuals who are interested in receiving the COVID vaccine at Spectrum and don't have access to a computer, they may call 267-670-7822. There is no cost to receiving the vaccine here at Spectrum. And again, all immunizations must be scheduled. Right now, those who are interested and who have registered online should expect to receive a call back within 7 business days. As you can imagine, we have a long list of people wanting to have the vaccine. And so I just ask that all interested parties give us time to get back, all calls will be responded to. We have a very well organized process here at Spectrum. The feedback that we've received from those patients who received their vaccine at Spectrum has been very, very positive. So thank you.
Okay, thank you, Veronica. Mrs. Ellie Colon will now present the prepared remarks in Spanish. There's Ellie.
She needs to unmute.
Yep, Ellie, if you can hear me, you can unmute yourself and start.
Thank you for your patience. Buenos días. Lo siguiente es información sobre las vacunas por el Dr. Farley. El Dr. Farley nos informó que el número de casos de coronavirus está aumentando. En lo que se refiere al suministro de dosis, hemos estado recibiendo un aumento en la oferta casi semanalmente. El gobierno federal dice ahora que no habrá más aumentos en las dosis de Pfizer y Moderna durante las próximas 3 semanas. Tampoco tenemos claro cuándo podemos recibir más vacunas de Johnson & Johnson. Con el aumento de proveedores y el rendimiento tendremos que vigilar cuidadosamente para asegurarnos de que el suministro cumpla con la capacidad de vacunación. En cuanto a la administración de las dosis, hasta el jueves hemos vacunado a 402,000 personas con la primera dosis y 156,000 con segunda dosis. Para la semana que terminó el 7 de marzo, se administraron 96,000 dosis. Se trata de un incremento de 54,000 respecto a la semana anterior. Para la semana que terminó el 14 de marzo, se administraron 104,000 dosis. Por lo tanto, casi hemos duplicado la administración de dosis en las últimas 2 semanas. La mayoría de las dosis fueron administradas en el centro de la ciudad, pero tuvimos aumentos por otros proveedores también. Un proveedor que está haciendo un trabajo excepcional es Spectrum Health, un centro de salud a nivel federal, llegando predominantemente a la población afroamericana en alto número. Administraron 795 dosis la semana pasada por mis datos. En cuanto a quién puede recibir la vacuna, todavía estamos en la fase 1B, que incluye trabajadores esenciales de primera línea, personas mayores de 65 años, personas con condiciones médicas de alto riesgo. Pronto añadiremos nuevos grupos a la fase 1B. Estos incluirán personas con discapacidad intelectual. Un nuevo estudio grande mostró que esas personas están en alto riesgo de mortalidad de COVID. El estudio fue escrito por el doctor John Gleason de Jefferson y coautor por la doctora Wendy Ross, quien discutió los hallazgos con el Comité Asesor de Vacunación. Otro grupo que está agregando son miembros del clero. Con el reinicio de los servicios religiosos, existe un alto riesgo de exposición a infección que potencialmente puede transmitir a muchas personas de la tercera edad de alto riesgo. ¿Cómo está la vacuna disponible hoy en día? Seguimos ampliando el número de proveedores. Por ejemplo, entre 8 y 10 farmacias independientes adicionales se inscribirán para la próxima semana. Nuevas clínicas comunitarias administradas por el Departamento de Salud Pública de Filadelfia esta semana y Departamento de Bomberos la próxima semana. También en las escuelas secundarias Simon Gratz en Nicetown y en el Grand Yesha Salón de Baile en el sur de Filadelfia. Y en el EOM Athletic Center en el sur de Filadelfia que abrió hoy. En algunos sitios, las citas anticipadas han sido bajas, por lo que el sábado pasado empezamos a tomar walk-ins elegibles. Los walk-ins estaban disponibles en Martin Luther King Older Adult Center en Simon Gratz High School y el proceso funcionó muy bien. No había espacio abierto para citas en la clínica de Grand Gisha en el sur de Filadelfia porque las reservas estaban llenas. Quiero recordarle a todo el mundo que no habrá walk-ins durante las clínicas de segunda dosis. Ahora, en el centro de convenciones, seguimos vacunando a 100,000 personas al día. Hemos vacunado a 90,000 personas desde que empezamos. Tenemos problemas vacunando a los residentes afroamericanos e hispanos de Filadelfia. Solo hemos vacunado 13% de la población afroamericana y 11% de los hispanos. Lo que esto significa es que hay bajas tasas de vacunación en vecindarios de bajos ingresos, predominantemente afroamericanos e hispanos. Por lo tanto, ahora estamos usando la mitad de las ranuras disponibles para walk-ins en 22 de los códigos postales vacunados más bajos en Filadelfia, que son elegibles por edad, condiciones médicas o empleo. Los primeros datos muestran que nuestro enfoque está funcionando. Ayer los datos muestran que el 23% de los afroamericanos y el 21% de los hispanos están vacunados. Esto es aproximadamente el doble. Seguiremos haciendo divulgación a esos barrios subvacunados para alentarlos. Las personas que quieren pueden visitar al www.phila.gov/vaccine-interest. Si no tienen acceso al Internet, pueden llamar al 311 y registrarán. Cuando se le notifique que es su turno, obtendrá varias oportunidades para establecer una cita. O si esto es de uno de los códigos postales designados y elegible por edad, personas mayores de 65 años o con una condición médica de alto riesgo. No necesita una cita para vacunarse en el centro de la ciudad. Pueden visitar al centro desde las 8 de la mañana hasta las 5 de la tarde, desde hoy hasta el lunes 22 de marzo. Favor de traer evidencia de dirección como identificación, factura, cualquier pieza de correo con su nombre y dirección. Gracias. Ahora las palabras de Spectrum Health. Spectrum Health Services Incorporated es un centro de salud federalmente calificado que opera clínicas comunitarias en Filadelfia. Una está ubicada en el 5201 de Haverford Avenue en el oeste de Filadelfia y otra en el 1325 de la calle 33 en el sur de Filadelfia. Spectrum Health ha sido un socio comunitario de confianza que ha servido a Filadelfia durante casi 55 años. Ofrecemos una gama completa de servicios que incluyen atención primaria de adultos y pediatra, dental, salud conductal, podología, nutrición y apoyo dietético, OBGYN, tratamiento y apoyo de VIH y SIDA y Hep C, farmacia programada 340B, pruebas y vacunación COVID-19. Los interesados en recibir la vacuna Moderna deben registrarse en línea yendo a www.spectrumhs.org y haga clic en el enlace. Para aquellos que no tienen acceso a computadora, llame al 267-670-7822. No hay costo para recibir la vacuna. Spectrum Health no puede acomodar citas sin previa, no walk-ins. Todas las inmunizaciones deben ser programadas. Debido a demanda actual, responderemos a todos aquellos que están inscribidos para la vacuna dentro de 7 a 10 días hábiles. Nuestro objetivo actual es proporcionar 1,000 vacunas cada semana y pedimos que los interesados en recibir la vacuna Moderna en uno de los centros de salud sean pacientes. Responderemos a todos los que se registren en línea o llamada. Muchas gracias.
Okay, thank you, Zelly. We will now move to Q&A. Reporters are asked to limit their questions to 2 or fewer. Please try to keep your questions focused on the topic at hand, which this week includes the work that Spectrum Health Services is doing. If there are any reporters who do not get an opportunity to ask questions, please follow up by email and we will get you an answer. First up, we have Mitch Blocker of NBC 10.
Thank you, Matt. Good afternoon. Dr. Farley, you've said a couple of times over these news conferences that the biggest hurdle for the city isn't really vaccine supply, it's more the distribution network. And I'm wondering, how is adding new groups going to stress your ability to distribute vaccines, especially without expecting an increase in doses for a while?
And the adding new groups obviously means that people who are not in new groups might get vaccine a little bit later. But the new groups we're adding here are not very large. And so I don't think it's going to make a big difference across the city as a whole. I do want to say, though, that what I've said in the past 3 weeks is what the limiting factor is our ability to deliver vaccine more so than the doses coming into the city. But we're now flat as far as how many doses are projected to come in the city over the next 3 weeks, while the number of doses we can administer is increasing. So it is possible that will shift at some point in the future, and we'll be back to being limited by how many doses we get in the city. I don't know that's the case, but I'm just sort of letting people know about that. A little concern in the back of my mind right now.
And you've said 1B is the biggest group. I think it's 400,000 people. How many people are in the newly eligible groups? And I guess down the road, how is adding that number going to affect people who are waiting for vaccinations who are in 1C and in group 2?
Yeah, I don't think these groups are very large. We looked into the intellectual disability group, and it's a fairly tight definition, and we're aware of somewhere like 7,000 to 8,000. And the immunosuppression group, I likewise don't think is very large. I don't have a hard number on that. And members of the clergy, I don't think is going to be very large. So I don't think it's going to make a big difference on that overall estimate for the phase 1B group.
And when I ask you questions about delays and things, I also want to ask you about some insight into maybe why Philadelphia is able to be in 1B and add groups at the same time that the rest of the state is stuck in 1A. What are you doing? What do you know that the state health department needs to pay attention to?
Much of the difference here really is in terminology. The state has classified the big group of people with medical conditions and over 65 as 1A. We've called them 1B. And so the people that we are vaccinating, the people that the rest of the state is vaccinating are much the same. The real difference is that we are already doing frontline essential workers, and they're not in the frontline essential workers yet. We have an awful lot of frontline essential workers here, grocery store workers who have a lot of exposure and it can transmit it in the community. And so vaccinating them does help protect them. So we thought it was reasonable to include them at this point.
All right, thanks, Mitch. Next, we have Pat Loeb of KYW.
Dr. Farley, could you quantify the increase in the number of new cases?
I can follow up on that. I can tell you that the average in the past week has been in the high 200s, and now we're probably averaging over 300.
Okay. And the vaccine board was asked to include poll workers in 1B since they're frontline essential workers. I was wondering the reasoning behind allowing in the city commissioner staff, which doesn't interact with hundreds of voters directly, but continuing to exclude poll workers from 1B.
So what I was told was that we were including in 1B people who work in the election office and have a lot of exposure to each other. As you may know, that there was spread that occurred at the time of vote counting with the November election. And so it's a fairly small number of workers there who have a lot of exposure. I don't know about the city commissioners themselves. But the much larger group of poll workers the committee looked at and didn't feel that they had enough exposure to be worth moving into 1B.
Okay, thanks, Pat. Next, we have Isabel Sanchez of Telemundo.
Hello, Dr. Farley. Good morning. I'm asking regarding any updates that we might have of the possibility of maybe another FEMA site of smaller scale opening in La Esperanza. We've heard from Reverendo Cortez that there are talks and he's feeling that this might move forward fairly soon. Any update on that?
Yeah, I could say that we are, seriously considering but we have an interest in having additional federally supported vaccinations in the city. We've had the conversations with the federal government for some time on that. And those discussions are seriously considering the Esperanza site as a potential site for that. I don't have anything I can confirm today, but we certainly need to get more services in the area of the city where we have the lowest vaccination rates. And that site is well situated for that reason.
And my second and last question would be, now, given that we're moving people to 1B, when do you expect to be moving to 1C, especially now that we know that maybe the allocation of vaccine is not going to increase in the following weeks?
Yeah, I would just say sometime in April, we expect to go into 1C. I can't tell you whether it's going to be early April or mid-April, and then go to phase 2 on May 1st.
Thank you.
Okay, thanks, Isabel. Next, we have Sean Walsh of the Inquirer.
Thanks very much. Dr. Farley, did you get a reason, or do you know why the supply from the federal government is leveling off?
No, we're not given those reasons.
Even if you didn't hear it directly from them, is it known why that's happening?
No, I don't. It's unfortunately the uncertainty as to how many doses we're going to get per week has been a problem from the very beginning, and even it was a bigger problem last December and January, where we were given numbers and then they would change the next day, and there was no guarantee even a week out. With the new federal administration, they're saying they can tell us what we're going to get for the next 3 weeks, and they have stuck with that. They can tell us that in the next 3 weeks we're getting level, but we don't know beyond that, and we're not given reasons as to why those numbers are what they are.
Thanks. And on the statistics you shared about the racial demographics of folks at the convention center since the walk-ups started happening, are those just for the walk-up population, or is that for everybody?
That's for everybody. I imagine if we limited it just to walk-up population, it would be even richer in minority groups.
Thank you, Sean. Next, we will go to Natasha Brown of CBS 3.
Hi, good afternoon. This question is for Dr. Farley. Dr. Farley, we understand that the CDC is now recommending 3 feet instead of 6 feet social distancing in schools. And we wanted to know if Philadelphia schools, now that they're in hybrid learning settings, if they will be moving to that as well.
So you're going to have to talk to the school district on that. As you know, I've felt for a long time that the schools can safely reopen, but they're the ones that make that decision.
Okay. In your opinion, that just overall in terms of the CDC's recommendation of 3 feet instead of 6 feet distancing period, do you think that's a good idea, or what are your thinking about that?
You know, I should double check the exact wording of that. I think that the CDC may be permitting it, but I'm not sure if they're recommending that. I would say in general that I have a very high opinion of the CDC, and whatever guidance they're saying, I will go with.
Okay. And one last question. This is just about the COVID outbreak at Mayfair Elementary. We understand that the school was shut down because of spread in the school, and now it's just virtual learning for students there. We know that more schools are coming online on Monday and are continuing to open up here in the city. And there's been some concern about contact tracing when it comes to something like this, if there is some kind of an outbreak at one of the schools. What is the protocol there? And is that something that you guys have established and that you're working with the schools on?
So I will say with schools opening, there will be cases in schools, there will be clusters in schools, there'll be spread in schools, and we have procedures for recommending that schools quarantine a group of students or a classroom, or in some cases an entire school. And so you can expect to see that. We do work with all the schools about this. We do need the assistance of the schools in identifying the children who may have been exposed, and we make recommendations about that. We don't have the ability to do all the contact tracing of every single contact at this point, because many of our contact tracing staff have been redeployed to work on vaccination. But we do, we work with every school on whenever they have a cluster.
Thank you, Natasha. Next, we have Katie Catra of 6ABC.
Hi, Dr. Farley. Thank you for your time. I got 2 questions for you. One is kind of a follow-up to Natasha's question. So the CDC is recommending 3 feet of space in classrooms. I did check their language on that. Okay. Does that concern you at all if there are going to be more students inside of a classroom now, or more students returning to school, more schools opening up?
As I said, we first I'll go with the CDC guidance, but I don't manage the schools. I'm the health director. I do think it's very important that the students wear masks at all times, that the teachers wear masks at all times. I think if they follow those, follow those guidance, that the risk can be minimized in schools. And I think it would be great to have kids back in school so that they can, because I think they will learn better in school than remotely.
Thank you. And then my second question is, there have been pleas from the Latino community. They've been coming together saying that the city needs to do better about vaccinating them. So I just wanted to know what's being done for the Latino community regarding vaccines. Do you have a percentage of them that have been vaccinated? And what are you doing to get out vaccines to them more?
Yeah, so if you look at our website, which now has an expanded dashboard, you can see our vaccination coverage by race and ethnicity. And sure enough, Hispanic Latinos are the most under-vaccinated racial ethnic group. And so the things we're doing include the walk-in plan, the open access plan at the convention center. So for people who are in the under-vaccinated zip codes, they don't need an appointment if they meet eligibility criteria. And that is working. As I said earlier today, we're now, as of yesterday, more than 20% of the people who were coming to the convention center were Hispanic. So that's a very high percentage. And we're really pleased to see that. We also know we need to make more services available in neighborhoods in the city where there are more Hispanic Latino populations. We're working on that through, federally qualified health centers, like the one you just heard from, and also pharmacies, and also the clinic operations that we're running.
Thank you.
Okay, this is our last call for questions. Any other reporters? Okay, seeing no more hands raised, that concludes today's press conference. Thank you for your participation in covering this important topic.